Beautiful people.
In some cases, wisdom teeth have adequate space to grow in. Normally, if wisdom teeth did not have that adequate space to grow in, they can grow in sideways, damage nearby teeth, or get trapped beneath the gums and cause infections. That's not good for you. You don't want any piece of that. Dr. Graves from AOMS is here today to discuss wisdom teeth removal and why actually now is a wise time to make that decision.
It's good for a lot of reasons, Andy. The first thing is that you're off school for Christmas break, so you don't have to miss school. You can have your surgery. You can recover over your break. The second is that your dental benefits are running out at the end of the year. And dental benefits, use it or lose it when it comes to dental benefits, right? Because at the end of the year, they're going to reset January the 1st. So it's an opportunity for people to take advantage of the benefit of their insurance and have their teeth out before the end of the year.
Let's talk about why. I mean, wisdom teeth, at one point, we had a use for them, but I guess as we've evolved, we don't need them.
Our mouths are getting smaller.
Yeah.
We're talking more.
We're talking more, but we're not like having, I mean, we're actually cooking food. We have utensils. We have all of these things. So
food's easier to eat, and when the food's easier to eat, you don't stimulate your bone, and your jaw gets a little bit smaller, and as the jaw gets smaller, the wisdom teeth get crowded, and then they get sideways, and they get impacted. So, if you looked at a couple hundred years ago, most people had room for their wisdom teeth, but now with the refinery of food, there's a lot less space in there for us.
So let's talk about getting it done. The younger you are, probably the better. The later you wait, it can be a bit problematic, right?
Right, and it's all based on what your x-ray looks like, but if you just went by generalities, you would say somewhere between 14 and 18 is typically when we like to take wisdom teeth out. And the reason we do that is the younger you are, the less the risk involved in having the teeth removed, and also the longer the recovery, the older you are. As we know, as we get older, I mean, we're talking about running on the treadmill. If you do that, you may be sore for 3 or 4 days, but if you remember when you're in high school, you could do that every day and you weren't sore. The same way with your wisdom teeth. All
right, so get it done early. Tooth damage. So that can cause some serious issues if you let those come in. It's overcrowding, and then it just causes, starts to push around, right?
A lot of people spend a lot of money on braces, right? And when you have those braces off, especially when you're younger and you have your braces and you have those removed when you're around 15 or 16 and those wisdom teeth come in, there is a chance that you could have a little bit of crowding that can cause some crowding from your ortho that would have to be fixed, and we know how expensive that is.
Right.
The other thing that we're worried about is as the tooth comes in sideways, it can damage the tooth in front of it. And that's a more realistic reason why we take these out.
So it's really easy to prevent these wisdom teeth complications. You schedule the appointment, you go in, and you get them out. Are there cases where you can look in on the x-rays and go, actually, in your case, they're fine, and then sometimes they're not even there, right?
Right. It's one of those things that we want to monitor, and that's something you would monitor with your general dentist. But if you looked across statistics, about 85% of people, their mouth is too small for wisdom teeth. And of those 85%, about 90% of those people will actually get a cavity in their wisdom tooth, even if they have enough room for it. Just because it's so far back there, they're really hard to keep clean in that area.
All right, so do me a favor. Give our friends over at AOMS a call, 353-1055. You can also learn more by going to EmeraldOralSurgery.com. And just recently, you guys have become a big thing on TikTok.
Right. So I am Dr. Graves on TikTok.
Okay.
And we post some videos about the office, more goofy stuff. If you want to watch surgery, you go to our Instagram page. But, I mean, we have videos that have 3-4 million views already, which is amazing to me, too.
Now, I've just watched them. I'm
blown away, right?
I'm blown away. Up next, Chef Bud is getting crafty with lobster. It's a recipe you'll want to sink your claws into. Join us as we head back to the table.